Morning, everyone. So it gives me very immense pleasure to welcome you all to this edition of Fever Foundation first ever quiz on fever related information and subject. And thank you all for registering and participating in the quiz. And now I will be just quickly running through the rules of the game, although all of you have been sent through a mail and then through your registered numbers. We have sent you all the details, but quickly I'll be running through the what are the rules of playing this quiz, and then I'll be handing you and I'll be introducing our quiz masters for and the judges for today, and then we will be starting the quiz. So can we have the slides, please? Yeah. So this is a scientific initiative from Fever Foundation. So you will be playing for the North Zone today. Yeah. Next slide. So the rules are the quiz is for only for the postgraduate students only. The quiz consists of multiple choice questions. There will be 20 such questions in the quiz, and you will have 20 seconds to answer each of them. The option to be selected by clicking on the text panel on the right hand side. So there will be a video displaying the option, but it is only for representation. You cannot click the button on the video. On the right hand side, you have a text panel where you need to click the button and select your option. And the participants are advised not to leave this platform and go to the YouTube. You cannot play the quiz on the YouTube. YouTube is only for viewing purpose. So you please stay on this platform for the entire quiz. So you will be able to only answer through this platform only. So therefore, please do not leave this platform until we complete the quiz for today. Once submitted, you will not be, it is not possible to revert it. There is no negative marking in the quiz. The winner will be selected on the maximum far right answer. Fastest finger, fast answer will be the winner. And in the event of tie, we will have a tiebreaker round, which will have 3 questions and to decide the winner. So it is advisable to use the laptop or desktop for a better experience of this quiz. Next, please. And it is also advisable to have in a place where there is good internet connectivity because it's an online quiz. And if our team finds any type of foul play, you will be automatically disqualified. And you should not use mobile phone for getting the answers from any of your colleagues sitting nearby. And Fever Foundation is not responsible for any form of technical error, such as poor internet connectivity, etc. Participation in the quiz implies that participants accept the integrity of these rules. The participants who have given incomplete or inaccurate personal or contact details will be disqualified. Non-compliance with the rules results in the automatic cancellation of the participation in the quiz and the candidacy for the prize. And please note that first and second winners will be selected today. And the first and second winner of this North Zone quiz will play as a team. You will be representing the North Zone and you will enter into national level quiz competition, which is FEFCON, which will be on November 5th and 6th at Bangalore. So you will be coming to Bangalore as a team to participate or to compete at the national level quiz. And the last and very important, our quiz master and judges decision will be final. All of us are binding by their decisions. So these are the rules, and I wish you all good luck for playing the this quiz, and may the best student win the quiz. And I would like to introduce our esteemed quiz master and judges for today. Next slide, please. Professor Dr. M.K. Sudarshan sir, MD, FAMS, Honorary FFPH from UK. Sir is the chairperson of Karnataka State COVID-19 Technical Advisory Committee of Government of Karnataka. He's a member of our advisory board of Fever Foundation. He's ex-director and currently holding a special post at above director's position at and also he was retired dean and principal and professor of HOD of Community Medicine in a reputed medical college, Keppegoda Institute of Medical Sciences, Bangalore. He's a member of WHO Expert Consultation on Rabies, Geneva. He's a chairman of Ethics Committee of Bangalore Medical College, Fortis Hospital, Bangalore, NABH assessor in clinical trials and ethics committee, New Delhi from 2015 till date. He has more than 100 publications in international and national index journals. He has authored several books on rabies in English, as well as he's written a lot of books for patient education in Kannada. Best Teacher Award from Indian Medical Association for Karnataka State in 2003. Government of Karnataka and Dr. B.C. Rai Awardee for Award for Achievement of Excellence in Medical Education. His government of Karnataka recently bestowed him with the Rajyotsava Award, which is a prestigious award for the Karnataka government for his exemplary work in COVID in 2021. And he was also recognized for his commitment and the work in the COVID-19. So government of Karnataka bestowed him Dr. Day Award in recognition of COVID-19 work in 2022. And Rajiv Gandhi University Health Sciences, he got the Eminent Teachers Award in 2022. Dr. Sudarshan sir, it's pleasure and privilege to have you with us as the judge sir today.
Thank you, madam. Thank you. Thank you.
Our another judge is another and the quiz masters. I'm going to run through it. Dr. Professor Anupam Prakash sir. He is MBBS MD, PGCC Hospital Medicine, General Medicine MD, and PGCC in the Hospital Management, PDCDM, FICP, MNAMS, FACP, and FIACM. He is currently the Director and Professor of Medicine and Head of Department of Accident Emergencies at Lady Hardinge Medical College and Associated Hospitals, New Delhi. He is Editor-in-Chief of Indian Journal of Medical Specialties, Associate Editor of API Textbook of Medicine, and member of governing body of API, President, Board of Management, Delhi Diabetic Forum, President of Indian Society of Atherosclerosis Research, and Vice Chairman of API Delhi State Chapter. He is member of several professional advisory boards, to name a few: Advisory Board of JAPI, JIACM, and Journal of Case Report. He is also advisory board of member of our Fever Foundation. Welcome, Dr. Anupam sir. It's a privilege to have you.
Thank you for a cordial welcome. Thank you so much.
And Dr. Jayant Pada is our another judge over here. Sir is a professor and head of the Department of Medicine at SCB Medical College, Cuttack, Odisha. He's a consultant in diabetes, metabolic, and critical care. He's a national president of CCDSI, chairman of API Odisha State Branch, governing body member of National API. He's organizing secretary of RSSDI 2017. He is also in the advisory Council of Governor of ACP of India and member of CWC IMA. He has several publications, more than 17 publications in national, international, peer-reviewed medical journals. He's been the principal investigator of many national and the global clinical trials. Sir, Dr. Panda, sir, it's a pleasure and privilege to have you as a judge here, sir. Welcome to you, sir.
Thank you. Thank you.
And we have Dr. Ghanshyam Pangte, sir, Professor of Medicine, Lady Hardinge Medical College, New Delhi, Rheumatology and Medical ICU in charge at LHMC, New Delhi. He's the Joint Secretary of Indian College of Physicians and API Delhi Chapter, Executive Member of Delhi Rheumatology Association and ISER. He's Associate Editor, API Textbook of Medicine, 9, 10, 11th edition. He has published more than 100 publications in index and non-index articles in reputed journals. He's a co-edited more than several books, to name a few: Pearls for Scientific Paper Writing, Research Methodology and Ethics in Clinical Research, and PRF. And he is also a very well-known teacher, medicine MD and NBE postgraduate teacher and examiner of Delhi AIIMS, Rajasthan. So, Professor Dr. Ghanshyam, sir, it's pleasure and privilege to have you with us, sir, today. Next. And Madam Dr. Subbalakshmi Margekar, she is the Professor, Department of Medicine at Lady Hardinge Medical College, New Delhi. She's a Fellow of Indian College of Physicians and Fellow of Association of Clinical Medicine, Coordinator in Chief Thalassemia Adult Daycare Center and Thalassemia Transition Care Center at Lady Hardinge Medical College, recipient of Dr. J.C. Patil and J.C. B.C. Mehta Award in Epicon 2014. She's been the faculty in Epicon from 15, 18, 19, and 20. Faculty and organizing team member of API, DSC, CME in 2019. She's been in the organizing committee and faculty in the team member of Diabicon 15, 16, 17, 18, 19, 20 as well, and delivered lectures, several lectures to name a few, Epicon, Diabicon, various other CMEs. She's been most sought after teachers and lectured across several professional conferences, participated in several multicentric international clinical and the national clinical trial, and he has guided 12 postgraduate students in their theses, and has several publications to her credit in peer-reviewed medical journals and books, and she's been part of the API textbook of medicine and medicine update. Dr. Subbalakshmi Madam, again, it's a privilege and pleasure to have you with us as the quiz master, ma'am. And we have Professor Dr. Ramesh Agarwal, sir. He is MD Medicine, FRCP UK, FICP, MNAMS. Presently, sir is working as Professor of Medicine at Lady Hardinge Medical College and Associated Hospital, New Delhi. He is a recipient of prestigious Srimati Pawan Kumari Jain Oration Award for outstanding work in the field of internal medicine. Chaired session and delivered lectures in various national and international conferences, to name a few, Diabicon, API, DSC, Epicon, annual conferences, etc. And he has also served on the board of management of Delhi Diabetic Forum. He has more than 70 publications in the national and the international journals. He has presented his paper in several national and international conferences. Dr. Professor Ramesh Agarwal, sir, I can welcome you to this session, and I request you to be the quiz master.
Thank you for your kind words,
pleasure,
ma'am.
sir.
Thank you, ma'am.
So, and now, may I now request and hand over to our quiz master, so Dr. Anupam Prakash, to take over first, and then others to conduct the proceed. Over to you, sir.
Thank you. A very good evening to everybody. Thank you, Fever Foundation, Dr. Manjula, Mr. Jayaraj, and thank you, judges, Dr. Sudarshan, Dr. Panda, and Dr. Ghanshyam is also there. Well, thank you so much. And the responsibility today that has been given or entrusted to us is to conduct the quiz for the North Zone. And incidentally, we happen to be sitting in the North Zone right now. But it is going to be an interesting quiz. We are already halfway through. We had 2 zones yesterday and day before. And after today, we will have another 1 quiz to be conducted. So 2 candidates, as Dr. Manjula has said, 2 of you will be participating and getting the first and second rank, and you will participate as a team together. And I think we will start the quiz without any other delay. Dr. Shubhlakshmi and Dr. Ramesh and Dr. Ghanshyam are all there to take us through today's quiz session. And I will request Dr. Sudarshan and Dr. Panda to give their inputs. So can we start the quiz? So we have Computer G there. Yes, I can see Computer G is there. And the scorer is also there. So everybody has to be on now. We will have a couple of dummy questions. I think we have some dummy questions for candidates.
Three dummy questions will
So
be
we
there.
have 3 dummy questions. Also, although it is teen tigada kaam bigada, but still, I hope it is 1-1-1 triple Nelson. So we will have 1-1-1. And you know, Nelson was a great person. 1-eyed, 1 hand, and 1 foot. And still, he won a long battle. He defeated Napoleon Bonaparte, who was the ruler emperor of UK. Unfortunately, we had the Queen Elizabeth, who has left for her heavenly abode. But anyhow, Computer Ji, I am just waiting for the first dummy question, talking to the participants. So best of luck to all the participants. We are here today. Yes. Great. So I am very poor at films, and the dummy question has something to do about films. But yes, postgraduates would be definitely very active about it. So the question is, which film is India's official entry for the 95th Oscars? Kashmir Files, Chalo Divas, Chalo Show, and RRR. So if answer, please, all of you should attempt it, A, B, C, or D. The timer has begun. Yes, 20 seconds you get for each question. For me, RRR is relative risk ratio. But that is definitely not a film. So let us hear from the audience participants. Yes, so the time is over now. Yes, so let us see how many of the people. What is the right answer? What is the right answer? Computer ji, zara bataiye. So cello show is the right answer. So obviously I didn't know anything about RRR. So I am pretty bad. For me, cello devas and cello show are also one and the same thing. Because if you have a day, then you will have to have a show also, or a show will follow on a day. But anyhow, Kashmir Files, I have heard something about Kashmir Files because it was in the newspapers. Unfortunately, I do read some newspapers. So for me, this was zero. If I would have been in your place, I would have scored zero in this. So importantly, the computer G will give us the answers, but the correct answer will not get the award. The correct answer with the person who gets it the fastest. So the fastest finger first, that person will get the award. So we will not see who is the fastest person in this because these are dummy questions. But yes, you can see there are many people who are like me. So that is the plus point. So there are many people who are like me because there are all types 1, 2, 3, 4. So maybe I'm not bad. If I again started doing my MD, so I will be as good as you probably. So good. I have not become very old. That means about 20 years later, also 25 years later. Well, anyhow, let us go to the second dummy question. That means there are responses from many candidates. So the question is, who is the current Chief Justice of India? Uday Umesh Lalit, Ranjan Gogoi, Sharad Arvind Bobde, and Nuthalalpati Venkat Ramanna. So the timer starts now. Yes, please start the timer. So you have 20 seconds, but you have to, even if you know the answer, you have to be very fast because somebody who presses the correct answer fastest will get the award. I am also poor. I know that the Chief Justice retired about a fortnight back, but I don't know who has succeeded him. So very good. So what is the correct answer, Computer Ji? Please enlighten me also. Uday Umesh Lalit, you Lalit. It is just like RRR for me. But anyhow, with due respect to the chair of Chief Justice, it is UUL. I will also remember. So yes, Ranjan Gogoi, I knew it was not there because he was there long time back. But other names are also as alien to me as number A. So Computer Ji, do we have the proportion of people who have got this right? I would have scored, maybe yes, there are 3 questions. That is why that is a problem. If you have 4 MCQs, then the probability of scoring one correct is after 1 out of 4. So they have kept only 3 so that I fail on all the 3. 2 I have failed. Third I will again check. Yes, the answer is many people know. So now that means that time is against me. My age is now I am aging. So A is the correct answer, and many of you have got it correct. So congratulations to those who have got it correct. But this is a dummy question. Don't expect rewards for it, or this will not go counting towards your total score. So yes, Computer Ji, we will move to the third question. Let us see. Now this is also Dash is newly appointed trustee of PM Cares Fund. Gautam Adani, Ratan Tata, Mukesh Ambani, Asim Premji. So timer starts now. These are very difficult questions for me.
So requesting to go slow.
Yes.
Dr. Anupam.
Yes, I heard it. I got
Dr.
it.
Anupam, yeah, I request you to go slow because now the timer there is 12 seconds
Okay.
at the student's end. At the
Okay.
student's
Good.
end, yeah, it is still 5 4 seconds. So
Okay.
so now it is 0 seconds there. So this much time lag is needed before you put in the answer.
Cheek. So Computer Ji, can we have the answers? Ratan Tata. Very good. So yes, we know about Ratan Tata. He has been an entrepreneur and he is one businessman that we all look forward to because there is a lot of ethics that has been with him when he is doing business. And definitely through the ages, his father also, J.R.D. Tata and now Ratan Tata, they have been there at the helm of affairs and they have done, even in COVID, you must have understood that a lot was donated and he was one of the first persons to do it. So I am not bad. I also don't know the answer, but yes, there are many people like me who do not know the answers. So well, I think most of the attempt, scorer will kindly let us know that yes, they are attempting correctly.
Yeah, 6-0.
Okay, that is wonderful. So now we move to the main session, and best of luck once again from all of us to the participants. So now we will move to the first question. Which one of the following treatments is ineffective in management of hyperthermia? Acetaminophen, ice packs in groins and axilla, IV cold saline, and bladder irrigation with cold saline. So you have four options. Your time begins now, and you have to, if you know the answer, put it correctly as fast as you can. 5, 4, yes, you are going. So time is running out now. So computer ji, can we have the correct answer? So the correct answer is A. Now I will just elaborate upon it. See, this is hyperthermia and not hyperpyrexia. And there is a difference between hyperpyrexia and hyperthermia. So in hyperpyrexia, whenever you have fever, the hypothalamic set point is reset at a higher level. And then NSAIDs or paracetamol or acetaminophen, they actually bring down the hypothalamic set point. But in hyperthermia, there is a problem in heat production. Either it is excess or there is less heat dissipation. So that mechanism of heat production is more or heat dissipation is less. So NSAIDs, the hypothalamic set point is not reset, and NSAIDs actually or acetaminophen or paracetamol is actually not indicated. So you have to use external or internal cooling measures whenever you are treating patients of hyperthermia. So this is important. And let us see how many of you got it right. So computer ji, आप elaborate करेंगे please. So many of you have got it right. Very good. So it is important. So acetaminophen is not to be used. Other things are part and parcel of external or internal cooling, and those mechanisms can be used. Now let us see who got the fastest finger first. Can you display the name, computer ji? Dr. Kanav Khanna. So congratulations, Dr. Kanav Khanna. You got it in 3 seconds. Very good. So you have prepared well for the quiz. I must say, acknowledge that and congrats to you. At least you are now in the fray because you got at least one question wrong, right. So thank you. And computer ji, दूसरे question पे चलते हैं. Let us see. We move to the second question. This is which one of the following patterns of fever is observed in enteric fever? Intermittent fever, continuous fever, Pell-Epstein fever, and relapsing fever. So you have four options and your time begins now. Read the question carefully and try to answer it also. So your time is running out. Those who have attempted, well and good. Otherwise, you just finalize it. So, well, what is the correct answer, computer ji? Can we display it? So there are lot many options, and we do have misconceptions at times. But characteristically in enteric fever or typhoid, what we call it commonly, the characteristic pattern that has been described traditionally is continuous fever. So it is important that we understand what is these different types of fever. Continuous fever is fever which has a which remains throughout the day and has variation of less than 1 degree centigrade throughout the day. So it will continue to be there. Yes, with rampant use of NSAIDs and paracetamol, this typical pattern is not commonly seen. But yes, characteristically in enteric fever, it is continuous fever, and there is a specific pattern also. After continuous fever, it is a step ladder fashion. So that is very, very important. Intermittent fever is, yes, you have intervals of freedom. So you will have fever which touches the baseline, and relapsing fever is you will have fever on some days and there will be gap. You will not have fever on some days. And Pell-Epstein fever, That is a very common MCQ that comes. It is fever that is characteristically described with Hodgkin's lymphoma. So these are important things, and I have just discussed all the four because when you actually deal with MCQs, you should know all the choices. That will make you enrich your knowledge also, and you will be able to identify it because another MCQ could be based upon relapsing fever or palepsine fever. Well, computer ji, can we have the answer, correct answer? So I mean the number of persons who got it right. So yes, quite a few significant percent, 50% have got it correct. But there are less than 50% people who have actually got it wrong also. But importantly, typhoid is very common and we should actually know what is the characteristic. And in fact, typhoid can present with septicemia and enteric fever can also have a varied manifestations involving all systems. Well, can you have the lucky winner for this question? The fastest finger first, Dr. Kanav Khanna again. Well done. And again, it is 3 seconds. So you are now leading in the forefront. Well, congratulations again, Dr. Kanav Khanna. So that is amazing. 2 questions on the trot and the fastest finger on both. So very good. Keep it up. Computer ji, can we move to the third question? Faggot sign or relative bradycardia may be seen in which one of the following clinical conditions? Rheumatic fever, streptococcal pneumonia, bubonic plague, COVID-19. So please read the question carefully and answer it as soon as the timer starts. So your time begins now. Time is running out. You don't have characteristic diseases out here mentioned in the choices, so that makes it a little tough. But yes, it is important for all of us to know the answer. Computer ji, can we go to the correct answer? COVID-19. Yes, very important. I think it is important for all of us to understand that COVID-19 was a new illness. We are dealing with it for the last 2.5 years. And importantly, you should understand relative bradycardia is also described with diseases like enteric fever and a whole lot of viral illnesses also. But important thing is that when COVID-19 came, we found that relative bradycardia or what is also known as Faggot sign. So relative bradycardia does not mean you have bradycardia. It is not sinus bradycardia. Sinus bradycardia is a heart rate of less than 60 beats per minute. When you talk of relative bradycardia, it is the rise in pulse is not as rise as you ordinarily expect when the fever is there. So whenever temperature is high, you expect that whenever temperature is high, you expect that the pulse rate will also rise. But in cases of relative bradycardia or when we say Faggot sign is positive, the rise in pulse is less than as anticipated for the rise in temperature. So a patient who is having 102 degree Fahrenheit temperature may be having a pulse rate of about 80 or 90 beats per minute. That indicates the pulse should have been risen. Around roughly it rises about 5 to 10 beats per minute with every degrees of temperature. So in that case, with 102 degree Fahrenheit, it should be roughly under 120. So this is important, but in this case, supposing it is 96, then that means this is relative bradycardia, and this is what is Faggot sign, and very characteristically seen with enteric fever and a whole lot of viral illnesses, and characteristically in COVID-19 also. So can we have the correct answer? How many people got it right? Oh, very good. People have 22% have got it right, and there was a little confusion about it. So unfortunately, yes, it was a tricky question and it was actually intended to be a tricky question. So when you have the basket of MCQs, there will be some questions which will be very simple, some will be very tough also, and at times some will be a little confusing or misleading. So you have to be very careful. Let us see who got the fastest finger first. Computer ji, Dr. Vineet Goel. So very good. We have another contestant in the fray. So Dr. Khanna will have good competition now. So we have some people, and this is so this was a tricky question. The time taken to answer is 5 seconds. So people did spend a little time to answer this question. Very good. Let us move to the next question. Computer ji. Congrats, Dr. Vineet. The vaccine that is known to offer some protection against monkeypox is chickenpox vaccine, smallpox vaccine, BCG vaccine, and measles vaccine. So A, B, C, D, please select the correct choice and as early as possible. So your time begins now. Time is running out. Please select your choices. Monkeypox is another disease which is there, and we are facing the brunt of it, although there are not too many cases. So it is important. Computer ji, can we have the correct answer? Now there are a whole lot of choices here. So smallpox vaccine is the correct answer, and even BCG was actually considered to be effective against COVID-19. So there were trials which were there. Measles vaccines trials are also there. So all four choices could have been an option. Chickenpox and monkeypox are pox related. Smallpox and monkeypox again are pox related. So when you attempt an MCQ, you can get confused because of this. But remember, monkeypox and smallpox, the virus for both the illnesses, it belongs to the same genera. So monkeypox is closely related to smallpox. And in fact, chickenpox is herpes virus family. So it is a totally different virus. So you should always remember, although it is again pox related, but this is not a common pox. This is a misnomer, you may say. It is because of the eruptions that it is called pox, and it has nothing to do with relation. So remember, smallpox was eradicated long time back, about 50 years back, less than 50 years, 45 years back. And smallpox, actually, the lesions are centrifugal. In chickenpox, the lesions are centripetal. And again, in monkeypox, the lesions are centrifugal. So you have the hands and the feet, which are more involved rather than the trunk, in smallpox as well as monkeypox. And that is what is characteristic. Both these diseases they belong to the same family of viruses. Unlike chickenpox, which is a herpes virus illness, and BCG vaccine, measles vaccine. So because the same virus family, the protection with smallpox vaccine is considered to be there for monkeypox. And chickenpox is not the right answer. So let us see how many of us got it correct. Computer ji zara dikhaएं please. Computer ji, can we have how many people got the answer correct? Computer ji नाराज हो गए हमसे. So yes, very good. Many people have got it correct. More than 50%, 55% have got it correct. So very good. Well done. So computer ji, can we have who got the fastest finger first? Dr. Jain. Very good. Congratulations, Dr. Jain. And he has taken 4 seconds. So everybody is just very close. And I must say the contest is becoming tougher and tougher now. So we have 4 questions and there are 3 competitors already in the fray. Well, best of luck to all the remaining ones also. I hope we have a new name every now and then, and that will be very helpful also, and it will be a very good contest. So can we go to the next question, computer ji? In the diagnosis of malaria, thick smear is done for identification of the species, determination of level of parasitemia, sensitivity testing, all of the above. So be careful while answering this question. Your time begins now. Well, these are very tricky questions. So your time ends now. So these are very tricky questions. I was saying, we all understand. We read it day in and day out when we are actually learning microbiology or in PSM also, and even in medicine also and pediatrics. But the problem is the distant we get from our MBBS days, the more difficult these questions linger on, because we are not doing it routinely. So those who do it routinely are able to answer it, but otherwise it is difficult. We tend to forget and we get confused. So the correct answer is you have two types, thick smear and thin smear. So I always remember it. Thick smear is identification of the parasite because you have thick. So you have more blood on the slide. So it will help you identify the parasite. So yes, computer जी ने कहा कि मैं आंसर गलत ना बता दूं तो उन्होंने मेरी हेल्प के लिए जल्दी बता दिया. Very good. So when you identify thick smear, you have lot of blood. So you will identify easily the parasite and you will be able to see the parasite. And if on a thin smear, you have less of blood, so you can see the details. So identification of the species is on a thick smear and the level of parastemia or identify whether a parasite exists or not is on a thick smear. So that is absolutely correct. Computer जी ने कह दिया correct तो correct ही है, उसमें कोई बात ही नहीं है. So let us see how so those who have gone for sensitivity testing and all of the above are actually wrong. So let us see how many of us got this wrong. All right. Computer ji madad karenge? Yes, very good. So there are people who know the answer and we are consistently touching the 50% mark. So at least 50% of us know the answer. So we are 4 right now visible also. So I think only 2 know answer. I don't know at times. Yes. So computer ji fastest finger kiska hai? Dr. Abhijit Sarkar. Oh, so now we have 5 questions and we have 4 competitors already in the fray. So this is going to be a very tough contest now. Well, congratulations, Dr. Abhijit Sarkar. We move to the next question. Question number 6. What is the primary monitoring investigation in dengue for management? Platelet count, hematocrit, total leukocyte count, hemoglobin. So we have 4 choices and your time begins now. The questions have been very intelligently planned, so be very careful while answering them. And I know it is very tough at times because you don't have second choice to correct it, your wrong answer. Well, your time ends now. And this is again a very tricky question. And at times it is, but it is a very important question because dengue is now virtually endemic and we have every 3rd, 4th year, we have a whole lot of cases across the length and breadth of the country. So computer ji, आप सही आंसर बताएंगे? नहीं तो फिर आप मेरी मदद करने आएंगे? Yes. So the answer is B, hematocrit. So I will just dwell into a little detail of it. For dengue, we all understand when we need to make a diagnosis, it is a non-specific fever unless until you have hemorrhagic manifestations. It is just a plain simple viral illness. And in a viral illness, when you have, there are a whole lot of viral illnesses. We have influenza, we have RSV, and we had COVID also. But when you have viral fever or a febrile undifferentiated fever with leukopenia and thrombocytopenia, then virtually you know that yes, this is dengue fever. And the fever will usually last for 3 to 5 days, at the most 7 days. This is characteristically what is dengue fever. But that helps you in diagnosis. But when you have to manage, it is the hematocrit which is very important. Hemoglobin can become low when you are actively bleeding, but hematocrit rises whenever the patient actually starts to have third space losses. And that is what actually is the cause of death in dengue patients. It is not hemorrhage. It is third space loss or intravascular leaks. So that is what actually have to be prevented. And that is the earliest sign in these patients is actually a narrow pulse pressure. The diastolic rises and the systolic starts to fall. And that is what is actually incipient shock, or you should consider it that the patient is going to be now deteriorating or the third space losses will start. So that is one sign we need to see. Patient will also have tachycardia and on a laboratory investigation, a rising hematocrit. Any patient who has a high hematocrit, that means that patient in the critical phase of the illness and you need to push in fluids. Push in fluids, if the patient can accept orally, give oral fluids also. Well, that is a point which we need to always understand and it has to be taken into account. So computer जी बताइए जरा कितने लोगों का सही आया? How many? Oh, so this is now we had only 2 choices. So hematocrit now this is good, very good. People know, and I think we will not keep this question next time because many people now understand that yes, they are on the right track. So maybe in another quiz we can have this question so that this 10% also goes off and we have 100% correct. Then we will be managing dengue in the right earnest, and I think we will be able to salvage patients also. So let us see who is the fastest finger first. Computer ji madad kare. Dr. Aditya Gupta. Now this is going to be very troublesome for all of us, and I think we will have to postpone the quiz at the end of it. There are so many contenders. If we don't have after the 6th question, we have 5 contenders. Dr. Sudarshan, आपसे मदद चाहिए होगी हमें end में.
Okay, okay.
Because
I'm
there are
here.
5 contenders already in 6
Yeah,
questions.
yeah.
By the end of 20, we don't know what will be there. So again, the
Yeah,
time lag is very short. They are answering very fast in 2,
yeah,
3, 4, 5 seconds.
yeah.
And there are 5 contenders. Congrats, Dr. Aditya. But yes, you are making our life tougher. So anyhow, congratulations. We move to the next question. But now
Yeah.
I'm handing over the baton to Dr. Ramesh. He will carry you forward in this quiz. I will rest my voice.
Thank you, Dr. Anupam, for the teaching both the faculty who are on the board and the students who have been actively participating in this quiz. So let us move to the next question, which is question number 7 of this quiz. Computer ji, please, question number 7. So the question is, which of the following do not represent leishmaniasis infection? Your choices are choice A, Kala Azar, choice B, Malta fever, choice C, Baghdad boil, and choice D is dum-dum fever. And your time starts now. So the time is over. And can we have the correct answer first? Okay, so Malta fever does not represent leishmaniasis infection. Again, leishmaniasis infection, as you all know, Kala Azar by the name, it is endemic in eastern part of the country and with some spillovers which we sometimes see in the central part of Delhi and other parts of the North India. And the disease has been endemic and still being continued despite availability of drugs like amphotericin and liposomal amphotericin B. So what about the other choices? Like Kala Azar, I think most of you have, most of you know that it is represented as a leishmaniasis. So Baghdad boil as a name suggests that the capital of Iraq, which is Baghdad, so it had witnessed war for so many years, and there was a time in the year 2004 when suddenly 300 soldiers were affected by leishmaniasis. Probably they were not using any repellents or mosquito nets, and since it was a huge casualty to the army, so it came as a Baghdad boil. Then the dum-dum fever, it is named after the Scottish doctor who was William Leishman, and the dum-dum is a place which is in Calcutta. So they have, just for the namesake, they have this fever is also known as dum-dum fever, leishmaniasis. Malta fever is not leishmaniasis, it is brucellosis. It's a zoonotic disease, and it also has some others name like rock fever, Banks disease, Mediterranean fever. So the correct answer is Malta fever. So can we have how many students have really got it right? So 61% of the students were right, and around 40% still were confused about this. So that's nice to learn. Okay, can we show Computer ji who is the winner of this question? So Dr. Abhijit Sarkar. Okay, so Dr. Abhijit, many congratulations. So probably this is your second question which is correct, and you are actively competing with Dr. Kanak, who also had got 2 questions right. So many congratulations to you, and we can have next question, Computer ji. So the gold standard for treatment of brucellosis in adults is choice number A. Is it ceftriaxone and rifampicin, or is it streptomycin and doxycycline? Choice C, is it gentamicin and ciprofloxacin? Choice D, is it trimethoprim, sulfamethoxazole, and rifampicin. And your time starts now. So the time is over, and I'm sure if okay, let us computer ji first show the right answer to the students. So the right answer is streptomycin and doxycycline. So this question will be interesting to know how many of you are able to answer this question, because if you look at the choices are very close. The choice A has a ceftriaxone and rifampicin. Choice B has got an aminoglycoside and a doxycycline. The choice C again has a aminoglycoside and a fluoroquinolone. And choice D has trimethoprim, sulfamethoxazine, and rifampicin. If you have read the question carefully, probably you would have been able to answer it. The standard of treatment for brucellosis in adults. So there is a difference between the treatment in adults and the children less than 8 years of age. And this is from Harrison. So the correct answer is streptomycin and doxycycline. And if there is an allergy to streptomycin and doxycycline, then there comes the other options, like you can use a combination of gentamicin and ciprofloxacin, but the choice is streptomycin and doxycycline. In children less than 8 years, the drug of choice will be trimethoprim, sulfamethoxazine, and rifampicin. So let us see how many of you are able to answer this question correctly. Computer ji, can we see the number of students who have answered it? Okay, so 70%. So this is a surprise for me. If you are able to answer this question correctly, it is really very heartening to know this. And who is the winner of this question? Dr. Aditi. So we have one more contestant who is entering this race to go to Bangalore, Dr. Manjula. So this competition is going to be really very interesting. So congratulations, Dr. Aditi. And we hope there are still many questions and you will be able to answer them and come in the forefront. So computer ji, can we have the next question? So the next question is, undulant fever is described in malaria. Choice B, scrub typhus. Choice C, leptospirosis. Choice D, brucellosis. And your time starts now. So the time is over. So computer ji, can we have the right answer? The correct answer is brucellosis. The question is not very difficult. The point here of repeatedly highlighting about brucellosis in this quiz is that it is now not a very uncommon disease. So we must be able to diagnose this disease, and first of all, we should be able to suspect this disease. The disease is it's an infectious disease which is caused by a Brucella species, and the organism is an aerobic intracellular Coccobacilli. As I already told you that it is also known by the name of Gibraltar fever, Crimean fever, goat fever, and what is more important is that people who are dealing with the poultry or the milk or the goat or the cow, so we must suspect someone who is coming to you with fever for prolonged duration, along with lymphadenopathy and organomegaly. And the closest differential will be tuberculosis in some cases. And in those cases, a careful history taken from the patient will give you the vital clue. Because the CT findings again in the abdomen will not be very specific, and then it may mimic tuberculosis only. So computer ji, Can we know how many of students have answered this correctly? So again, lot many of you are aware of this question. Question was not very difficult, and the idea here was to make you aware about brucellosis. So 60% of the students have answered it correctly. And who is the winner of this question? So Dr. Aditi. Okay, so Dr. Aditi has taken less than 2 seconds to answer this question. Many, many congratulations, Dr. Aditi. So can we move to the next question, Computer Ji? So the next question is that following features are suggestive of poor prognosis in severe falciparum malaria, except, is it hyperglycemia? Is it leukocytosis? Choice C, is it hyperparasitemia? Choice D, is it severe anemia? So your time starts now. Okay, so your time is up. Again, malaria, as Dr. Anupam told in the initial quiz, that malaria is a very common disease, which is, of course, prevalent all over the India, and simultaneously dengue, malaria, and of course with intermittent COVID. So this is disturbing throughout the India. But the now complicated malaria or severe malaria is not only limited to falciparum malaria, as you all know. Vivex is equally causing a lot many complications in as far as malaria is concerned. But by definition, if you have read this question carefully, the poor prognosis in severe malaria are if the parasites are too much, like hyperparasitemia. Computer ji, can we have the right answer? Yeah. So hyperglycemia is the correct answer. That means it is not a poor prognostic marker. The poor prognostic marker are hyperparasitemia, leukocytosis, and severe anemia. What happens in malaria is the hypoglycemia. It is because of the decreased gluconeogenesis. And earlier, when the quinine was very commonly used, it was one of the major cause of hypoglycemia in patients. And vomiting, decreased appetite by the patient, they all lead to hypoglycemia. And it is one of the important things that residents and the doctors should be aware that when we treat malaria, the sugar levels may go down. So we have to be watchful for them. So can we have the breakup of how many students could answer this question correctly, Computer Ji? So of course, the number is now more than 60%. So it's good that you are aware that hyperglycemia is not a poor prognostic marker. And who is the winner of this question? Computer Ji, who is the winner of this question? So Dr. Kanav Khanna. Okay. Dr. Kanav Khanna. Very, very, very congratulations, Dr. Kanav. You have answered this question correctly. So can we have the next question, Computer Ji? So the next question is treatment of leptospirosis in penicillin allergic patients is choice A, gentamicin, choice B, chloramphenicol, choice C, erythromycin, and choice D, sulfa drugs. So your time starts now. Okay, the time is over. Again, the leptospirosis is not an uncommon disease now. Mostly it was limited to the southern part of the India during monsoons in the earlier days. But nowadays we all can see the patients of leptospirosis in the medical wards. The patient typically will have a fever along with jaundice and sometimes with neurological problems, and a history of exposure to the sewers or maybe to the urine of the rats is the etiology behind the for developing leptospirosis. And the treatment is very important because a single dose of an antibiotic will save the patient. And if the treatment is delayed, then the disease will be fatal. So, computer ji, can we have the right answer first? So, in the patients who are not penicillin allergic, so the drug of choice is penicillin or ceftriaxone. But here the problem is, if the patient is allergic to penicillin, then which of these drugs to be used? And this drug will sometimes be also useful in pregnant patients when they develop leptospirosis. So erythromycin is the right choice in penicillin allergic patients for treating leptospirosis. Computer ji, are we ready with the results? How many students have been able to answer this question correctly? So again, 52% of the students are able to answer this question correctly. So this was a little tricky question. Of course, the straightforward question would have been that what is a drug of choice for treating leptospirosis? But there are situations when the patient is allergic to ceftriaxone and it becomes difficult and you need an alternative. And erythromycin is one such drug which can be easily given to the patients, and it can have the same remarkable effects as when we use ceftriaxone. So who is the lucky winner of this question? Dr. Anmol. Okay, so we have another competitor in the list. Dr. Anmol, well, many congratulations for answering this question correctly. And you have been able to answer this question very quickly. Probably it must be some experience of in your medical wards that you are aware of this question, the answer to this question. Thank you, Dr. Anmol. Congratulations. Computer ji, can we have the next question? Increase in rate of fluid infusion in dengue hemorrhagic fever is driven by A, 20% rise in hematocrit, B, 10% rise in hematocrit, C, platelet count below 10,000, D, platelet count below 20,000. And your time starts now. So the time is over. Computer ji, can we have the right answer? So 20% rise in hematocrit. Again, this is a common question, but a very tricky question. As Dr. Anupam already gave you and explained you that when you are treating dengue, especially dengue hemorrhagic fever or dengue shock syndrome, it is primarily governed by the treatment is governed by the hematocrit and not the platelets. So platelets you give when the patient is actively bleeding in the form of epistaxis or hematomesis or internal bleeding or hematochezia. But the amount of fluid which has to be given is driven by the rise in hematocrit. So any 20% rise in the baseline hematocrit, it will reflect that the patient is having a third space volume loss, and that becomes an indication to intensify the rate by which you give or infuse fluids. And probably you may have to use sometimes colloids instead of crystalloids when such a rapid rise in hematocrit occurs. And the same formula you use when you are watching the response to your treatment. The fall in hematocrit with the improvement in the clinical condition of the patient will be equally important in judging how much fluid you have to decrease as the patient is responding. So this is a clinical bedside question, and in day-to-day practice, dengue is this type of knowledge will help you in better treating the patients. So computer ji, can we have the breakup who all are be able to answer this question? So 60% of the students have not able to answer this question correctly. Again, I said that this was a little tricky question. Of course, the platelet is almost ruled out, as we can see from the results. Around say 7 to 8% of the students are still confused at hematocrit or between hematocrit and platelet. Probably this question will clear their doubts. Only 31% of the students could answer this question correctly. So many congratulations to all those who could answer this. And who is the winner of this question? Who could do it very fast? So Dr. Akash Malhotra. Many congratulations, Dr. Akash, to you for answering this question correctly and in a timely manner. So, Computer ji, can we move to the next question? So the next question on your screen is, which of the following statements is true about use of phosphomycin in urinary tract infections? A, it is given intravenously for 10 days. B, it is given orally dosing in BD dosing with meals. It is given as a sachet to be dissolved in milk and given empty stomach. Or choice D, it is given orally at bedtime with water and after urination. And your time starts now. Okay, the time is over. So can we have the correct answer, Computer ji? So the correct answer, it is given orally at bedtime with water after urination. So I'm sure almost 60 to 70% will be knowing about this, and most of you may have some confusions. Urinary tract infections, you all know, are uncomplicated, complicated, and catheter associated. And we all deal and treat such patients. Because of the rampant use of and irrational use of antibiotics, again, there is a lot of resistance which has come in for treating UTIs. And you must all be seeing that the commonly used drugs like nitrofurantoin and fluoroquinolones, they are mostly resistant as far as the treatment of UTIs is concerned. Now, phosphomycin is a drug which probably I think people from medicine, they use it less reluctantly, at least at our center. But it is again a drug which can be used orally instead of intravenously. And but some precautions have to be taken when this drug has to be given, that it is given at bedtime and with water. It's a sachet or granules which has to be dissolved in water in a glass, and it can be then taken by the patient at bedtime after urination. And in complicated UTIs, you have to give this drug for some more time rather than 1 day. But in uncomplicated UTIs, only a single dose will be sufficient. And the precaution which has to be taken is that, again, it has not to be taken with meals. So either the patient has to take it in the early morning or 2 hours after meal or at the bedtime, which is more preferable. So the choices were close enough. And Computer ji, can we see how many of the students were able to answer this question correctly? So, again, the choices, the responses from the students itself shows that there is a lot of confusion, and probably as we are not using it, that's why we have got a confusion in answering this question. 55% of the students were not sure and they marked it incorrectly, and 40% of students could answer it correctly. And who is the lucky winner for this particular question, Computer ji? Dr. Naveen Chhaba. Congratulations, Dr. Naveen. So this quiz is going to be really very, very interesting. So we have now probably half of the competitors, half of the winners are now there. Like if we have probably done somewhere about 13 or 14 questions, and there are more than 7 or 8 winners, which I can see. So many congratulations, Dr. Naveen. And I think Dr. Shubhalakshmi, you can take over from me after this.
Yeah, sure. Thank you, Dr. Ramesh. And we can move to the next question if Computer G is ready with it. Okay, so we have seen gold standard test for diagnosis of scrub typhus is indirect immune fluorescence, ELISA, blood culture, wheel flex test. Your time starts now. So time is over, I think, already over. And this scrub typhus is also very common, or now it has been like few years that we are able to diagnose it very frequently, seeing more cases. So we should be aware of the diagnosis also, how to make it. So Computer Ji, can we have the answer? Correct answer? Okay, so indirect immune fluorescence. So what about the other, that ELISA, wheel flex, and blood culture? This scrub typhus, as I told, it is also known as bush typhus. Mainly the patient present with to us with fever, body ache, rashes sometimes, and specific rash is present, which is known as ischar. So if it is present, it is like diagnosis of scrub typhus is almost confirmed. But if it is not, because it is not always seen, so if it is not, then we have to, or otherwise also we have to go for these investigational tests. So ELISA, it is one of the very sensitive tests and a specific test, but still it is not it is not the gold standard. Why? Just because it requires a special pairing test. Pairing is required for sampling, so it is not the gold standard. Blood culture, again, it is not always that we can find the organism in it, and it also takes time and expertise of the person who is doing it. Wheel Felix, it was initially used as one of the tests for diagnosis, but because of cross reactivity and low specificity and sensitivity, it is not used now as a gold standard. So indirect immune fluorescence, it is used, and it requires, it is used because of its higher specificity and sensitivity in diagnosing this disease. So Computer Ji, if we are ready with the percentage of students that have answered correctly. Okay, so nice. It is 38% almost, but still confusion is there. And as I told, this scrub typhus is a tropical infection, and we should be knowing more about this. So we need to a bit more this thing with this question or with this topic. So Computer Ji, who has answered it correctly? Can we know the name? Okay, Love Preet Combos. So again, one more competitor who has entered the list. So many congratulations, Dr. Love Preet. The answer has been documented in 4 seconds. So that is very great, very good. So, okay, now moving on to the next question. Computer Ji, are we ready with the next question? Okay. So in cyclical neutropenia, fever returns every how many days? 3 days, 9 days, 21 days, or 28 days. Your time starts now. So time is almost over. This neutropenia term we are very well aware of, but what is this cyclical neutropenia? So this we will see. Computer Ji, can we have the correct answer first? Okay, so 21 days. So what is this cyclical neutropenia? It is a rare hematological disorder or condition which is characterized by regular fluctuation of this neutropenia or neutrophil levels, which is seen in every 21 days. So once neutropenia is there, patient will have, or it will manifest as fever in the patient. So it is like question is like fever returns every 21 days because of this neutropenia only. Fever, oral ulcer, gingivitis, tonsillitis, pharyngitis, and dermatological infection or manifestation are also seen in this this cyclical neutropenia. Lymph node may be palpable, and this is how it is known as cyclical, because it returns in every 21 day. It is cyclical, and this fluctuation of neutrophil levels lead to this neutropenia. So Computer Ji, do we have the participant percentage who have answered this question correctly? Very nice. So 60% of us are aware of this cyclical neutropenia. This is very nice. Who has answered it quickly? Computer Ji, can we have the name, please? Anni Abhishek Sharma. Very well done, Dr. Anni Abhishek. And you have answered it in 3 seconds. Very nice. So this cyclical neutropenia we should be aware of, because if we are not, then we can misdiagnose, or this can just go as a FUO. So we should be aware of this condition. Can we have the next question, Computer Ji? Okay. So Covishield vaccine for COVID-19 is a killed vaccine, subunit vaccine, adenovectored vaccine, or live attenuated vaccine. Your time starts now. Okay, so time is almost over, and we are all aware of this COVID infection because last 2 years we are all seeing this. So Computer Ji, first we will have the correct answer, and then we will discuss. Okay, so adenovectored vaccine. So Covishield was one of the vaccine which was available in India, and many of us have got vaccinated with this Covishield vaccine. But there are many other type of vaccine which were available in India as well as in other countries. So adenovector vaccine, it was a recombinant vaccine, and almost 72% efficacy was seen against COVID-19, and it contains genetically modified organism. Other vaccines like subunit vaccine, it was a protein subunit vaccine used for this COVID-19, and killed vaccine. Again, this was not the Covishield, it was not a killed vaccine. And live attenuated, definitely not. It was not, because it was adenovector vaccine. Other vaccines like Covaxin and Moderna, these were all available with us for this COVID-19 infection. So Computer Ji, can we have the correct percentage of patient students? Okay, so 39% of us have answered it correctly. So that means we are all aware of this COVID, and we have read and we have learned a lot from this, but still confusion is there. This should not be that much. So Computer Ji, who has answered it correctly, can we know? Suman Saurabh. So very nice, but he has taken 5 seconds. So it was not so easy, I think. But yes, congratulations, Dr. Suman Saurabh. Now moving on to the next question. Computer Ji, can we have the next question? Yes. So humanity has but 3 great enemies: fever, famine, and war. Of these by war, the greatest by war, the most terrible is fever. Who said this? John Hopkins, William Osler, Hippocrates, or Alexander Fleming? Your time starts now. Okay, so time is over now. So this is a very common saying, or we have heard this line many times. So Computer Ji, first tell who has, what is the correct answer for this question? Okay, so William Osler. Who was he? He was a Canadian physician, one of the 4 founding profession of John Hopkins Hospital. So he was the founder member, founder funding member of this John Hopkins Hospital. He has been described as a father of modern medicine and one of the greatest diagnostician ever to be wielded with stethoscope. So this he has given this line that fever, famine, and war, of these by the far the greatest, by far the most terrible is fever. John Hopkins, he was another. He was a fund. He was there in the funded hospital that William Osler has funded, and he was a Quaker entrepreneur, and in the University of Maryland. Hippocrates, we all know, he has given the Hippocratic oath, and he is known for that. Alexander Fleming, he is known for the discovery of penicillin, that and the group of drug which we are using now also. So, Computer Ji, can we have the percentage of student who has given the correct answer?
I think 100%. I think most.
Oh, no, no.
So 53% of them has given this as an answer. So, but yes, we should be knowing about these names of the person who are attached or who was linked with the medicine. Computer Ji, who has given the correct answer quickly? Vijay Kumar Jat. So congratulations, Dr. Vijay. He has answered in 3 seconds. Answer this question in 3 seconds. So that is great. Congratulations. And moving on to the next question. Computer Ji, if we are ready with the next question. Yes. So in a patient with FUO, the detection of a classical neurological finding, that is oculomesticatory myorrhythmia, is pathognomic of which infection? Q fever, Whipple's disease, non-tuberculous mycobacteria, or leprosy? Your time starts now. Okay, so now the time is over. This oculomesticatory myorrhythmia, this is pathognomic of this disease. So let's see what is the correct answer. Computer Ji, Whipple's disease. Okay, so what is this Whipple's disease, or what is this oculomesticatory myorrhythmia? So Whipple's disease is a systemic, it is a rare systemic bacterial infection that affects the joint as well as the gastrointestinal tract. And this may cause this pathognomic oculomesticatory myorrhythmia. What is it? It is actually the eye movement disturbance and myorrhythmia, that is rapid repetitive movement of the muscle of the face, and it is together referred to as oculomesticatory myorrhythmia. So if it is present, it is pathognomic of this Whipple's disease. Other are Q fever, non-tuberculous mycobacterium, and leprosy, we are all aware of. So this finding is specific to this Whipple's disease. So Computer Ji, can we have the percentage of students that have answered it correctly? So if we are not able to detect the fever or detect the cause of the fever, but still this finding is there, then we can go for Whipple's disease. So 57% of the students have answered it correctly. That is very nice. But yes, other have few confusion in it. So this pathognomic feature should be known because it is diagnostic, almost diagnostic of this disease. So Computer Ji, can we know the person who has answered this question correctly in few fraction of seconds? Aditi Tongar. So Aditi has answered it in 6 seconds. So that is good. Congratulations, Dr. Aditi. And that you have read this question before also, or this topic before, that is good. So moving on to the next question. Computer Ji, do we have the next question? Yes. The number of days recommended by WHO to observe a dog for sign of rabies is 10 days, 15 days, 7 days, or 5 days. Your time starts now. So the time is over now. So rabies, it is one of the commonest this infection or bite we see, and dog bite is very common. Very now and then we are hearing about the news of this dog bite, or the people are terrified by this dogs here and there. So we should be knowing about this because we have to observe the dog as well. So computer ji, can we have the correct answer first? So 10 days. So as we are we were just discussing that dogs, if they bite or if they lick, there are grades of infection. We grade it as category 1, category 2, category 3 of rabies. If they have licked the non-breached surface of the skin, then it is category 1. If breached surface is licked, it is category 2. And if it is the scratch mark or bite mark is there with this breach of the mucosa, then it is category 3. And if this infection is left untreated, can be fatal also. So when to observe, till when we have to observe this dog. So the infection, a symptom of this rabies can be seen up to 10 days, can appear in a dog within 10 days or up to 10 days. But yes, it can vary up till month also, because non-infectious, or you can say non-symptomatic period is also there, which can be seen in this. And at that time, what happens, the virus is in latent stage and dog behaves very normally. So it can be missed also if this is in no symptom phase. And other symptoms are like abnormal behavior of the dog, that is lethargy, sometimes aggressive behavior, or sometimes the dog is very lethargic, and licking of the wound is also very commonly seen and observed and has been reported also. So let us see.
Ma'am, Professor Sudarshan sir is there. He is the WHO expert on rabies. So if we can add, so that students will be benefited.
Yes, definitely.
From my 15 years of working for rabies as an expert in WHO Geneva, what I would like to say is this is a well accepted thing, and it is a standard that in rabies endemic countries like India, let us be India focused, if there is a dog bite and if the dog is observable, so we start the post-exposure treatment, but observe the dog for signs of rabies. And if by 10 days, if there are no signs, then we can stop the treatment. That is the series of vaccination. You would usually 3 doses would have been taken, and this will be considered as a pre-exposure vaccination for future. So that is advantage. And 28th September is World Rabies Day. So that is a few days from now. And it is the death anniversary of Louis Pasteur. And the theme for this year's World Rabies Day is One Health and Zero Death. So we should not have dog-mediated, dog-transmitted human rabies deaths by 2030. So this is a WHO goal, and India also is a signatory, and we are also working for achieving this goal by 2030. That is, no human rabies deaths subsequent to a dog bite by 2030. I think I have taken sufficient time. It is back to the quiz master and to the computer G. Thank you, madam. Thank you.
Thank you very much, sir, for enlightening us.
Thank you.
So this was very information required and will definitely benefit the student as well. So computer G, can we have the student percentage that has been answered correctly? So 68%, I think 69%. So that is good. That is good that our students are also aware that we have to observe the dog for 10 days. And others have some confusion, but yes, the sir has already cleared our confusion that 10 days has to be observed, and the dog has to be observed for 10 days. So let us see who has answered it quickly. Computer Ji, can we have the name? So Dr. Vineet Goyal in 4 seconds. Very nice. Congratulations, Dr. Vineet. And I think rabies is a very important topic to be known and read, and we should be aware of each and every aspect of this topic. So congratulations. Now moving on to the next question. Computer Ji, can we move to the next question?
Last question.
Yes, sir. Last question.
Hopefully, sir, if no tie break.
So, which of the following readings qualify for elevated temperature? Temperature in evening around 5 p.m., that is more than 37.0 degrees centigrade. Temperature in morning around 5 a.m., 37.6 degrees centigrade. Temperature anytime during the day more than 37.2 degrees centigrade. And temperature in afternoon around 1 p.m., that more than 36.5 degrees centigrade. Your time starts now. Okay, so time is over. So again, to the basic, fever and temperature. This is very important topic, and we should be knowing the variation, the normalcy, when we will call it normal, when it is elevated. So computer ji, can we have the correct answer? Okay, so here is the correct answer. Temperature in the morning around 5 a.m. is 37.6 degrees centigrade. So there is variation of about 1 degree Fahrenheit in the morning and the evening, that we should be aware. And when it is called abnormal, when it is normal, that is also important. So when we call it normal is 37 degrees centigrade or 98.6 degree Fahrenheit. This we consider to be normal. Any variation with this is abnormal. Usually the oral temperature is considered to be more accurate because it is nearer to the core temperature. So that should be taken and preferred to be taken. Otherwise, auxiliary in wards and otherwise, auxiliary temperature is also used, but it should be used accordingly. So computer ji, can we have the percentage of students they have answered the question correctly? Okay, so 72% have answered it correctly. That is good because this is the basic topic. Fever quiz with fever question is a must. So that is very nice. So let us see who has answered it correctly within time or in a quick time. So Naveen Chhaba, Dr. Naveen Chhaba has answered this question in 4 seconds. So congratulations, Dr. Naveen. So Manjula madam, can we have
Yeah,
move on to
ma'am.
this? Yeah, please take this thing.
Yeah. Thank you so much, ma'am. We require our computer IT team will be consolidating the thing. And Sir Panda, sir, if sir is around, if he wants to make any quick comments before we go and announce the results. Sir, Jayan Kumar, sir, is there? Panda, sir? Anupam, sir, any last minutes or before
Dr. Panda is there on 2 devices. Probably he must be having problem in logging in. But anyhow, so with blessings of Dr. Sudarshan, sir, I would just say that yes, it has been a very interesting quiz because never I have witnessed that out of 20 questions, there would be 15 competitors or 14 competitors. So that is really very strange. And I must compliment Dr. Ramesh, Dr. Ghansham, and Dr. Shubhlakshmi for making it a very interesting questionnaire because the questions in the quiz, they range not only from hyperthermia to fever as the last question, definition of fever, and also there were a variety of infections, not only clinical signs like rash, eschar, and jaundice, and but also apart from that, there were a whole lot of diseases. So anybody who has actually read different topics or all tropical diseases and different aspects of fever would only be able to answer. And probably, I think there is a message for all the competitors that you have probably, most of you have probably read some topics very well. That is why you have been able to answer in 3, 4, 5 seconds, because it is really very strange that all the questions have been answered in 3, 4, 5 seconds only. There were no questions which took you very long. So you are master ace of one subject or one topic, but to have a, I would say, wholesome or composite view of all the diseases is actually very, 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 very essential in a country like India, which is as diverse as Dr. Ramesh was saying. East, you have Kala-Azar, then you have leptospirosis, which is down south, then you have scrub typhus, which was having pockets some years back. and now you have scrub typhus in the sub-Himalayan, northeast belt also. And again, you have diseases like dengue, which when I did my MBBS, they were probably not so rampant. And in last 25 to 30 years, now they are there. And every third year, fourth year, you know that you will have a big outbreak, which will be there over and above the baseline. So the quiz has been, I would say, it is a very interesting quiz, and it is actually, that is why probably there are not many scorers. I don't think anybody would score more than 3 or 4 out of 20 questions. So that is actually the problem. But yes, I think that message is very important, that all the students that have participated, they actually have to go through tropical infections, because mind you, these cases do not come to you in examinations, because you get a neuro case, you get a gastro case, you get a this cardiovascular, respiratory, connective tissue disorder, as Dr. Suresh was there yesterday. You get collagen vascular disorders. You get all kinds of cases. You don't get tropical infections because they have fever, which we consider ordinary. But remember, Dr. Shubhlakshmi said, William Osler said, it is the most terrible when you are not able to diagnose these patients. And these fever patients are the bread and butter of any general practitioner, any physician. Because fever, everybody will have. There is not a single person who will not have fever. And everybody who has fever, most of them will seek advice, unless until it remits with paracetamol or dolo of Dr. Manjula. But still, that is the problem, because so I would again request, seeing this message, actually, I have a bad habit of analyzing everything. So I feel that we should spend more time on tropical diseases and infections, because anywhere you go, today only I would give you an example. I'm sorry. We have time, Dr. Manjula?
Yes, sir. You please go ahead.
So today only somebody was asking me for yellow fever vaccine. We don't see yellow fever in India. We don't actually deal with it. But yes, when you travel abroad, especially to African countries, you need to get a vaccination. And then what are the indications? What are the contraindications? When you should get it done? The time of travel before you leave the airport or you fly off. All these things are important. Similarly, we had a resident who has gone to Antarctica for 6 months. You have to get vaccinations. You have to get certifications. All those things are important. Every year at Delhi, we face people go for Amarnath Yatra. So there are so many problems. People go for Hajj, especially in another part, even in southern part, there are areas where you have international airports. You have all kinds of vaccinations, all kinds of diseases, and even diseases which affect travelers. Traveler diarrhea is a small chapter in every book. But the thing is, when you actually manage Hajj areas where you have Hajj prayers, Kumbh Melas, these conglomerations will continue, and tropical disease will also continue. It is prevention which is actually very important, and knowledge about all these is very, very important. Otherwise, you cannot prevent. If you do not have the knowledge that what actually is required, then you will not be able to manage these things. And once or the other, we will land to trouble. Well, I think I have spoken enough. Thank you so much, Dr. Sudarshan, sir. Dr. Manjula,
Yeah.
please.
Yeah. So, madam, do we have time?
Yes, sir. You can make your
Yeah,
comments.
yeah,
sir.
yeah, yeah. So when the results are ready, you can tell me. Now the results are ready. I
Yeah,
will stop.
before
Yeah.
results, I would like to
Yeah.
talk about case presentation competition. You can complete, sir. Then I will.
Yeah, no, not much actually. It is in continuation of what I was telling about rabies. From my 3 decades of experience, what I have noticed is generally there is a confusion between dog bite and human rabies. Dog bite is a injury and is a clinical condition, whereas human rabies is a disease, and both have different ICD codes. And so, dog bite is the beginning of, if not treated properly, post-exposure treatment or post-bite treatment, first aid and vaccine and immunoglobulin, rabies immunoglobulin or monoclonal antibodies. Then there will be a viral entry inside a nerve, and then through the exoplasm it will reach the brain, and there is no cure. So the post-exposure prophylaxis is life-saving, and now with this end rabies by 2030, India is also a signatory to the WHO goal, and now it is planned to strengthen post-exposure prophylaxis in all the government hospitals, because majority of the dog bite victims are poor. They don't get the vaccine and immunoglobulin. This is one aspect. And the other one is actually mass dog vaccination. I will limit it to humans. And the new arsenal has come for managing dog bites. Earlier, it was rabies immunoglobulin, human and equine. Now, rabies monoclonal antibodies have become available. Both are produced in India and they're available in all the major cities. And one can also now use monoclonal antibodies, which are cheaper than HRIG, and no test dose is required. And any small bleeding wound is a category 3 exposure, and we should treat it with a rabies immunoglobulin or rabies monoclonal antibody. And vaccine is for everybody, all exposed persons, category 2 and 3. So with this, I stop, and it is back to Dr. Manjula. Yes, madam. Yeah, please.
Thank you so much, sir. Thanks all the panelists, Sudarshan sir, Anupam sir, Ramesh Agarwal sir, and Lakshmi, Pankte sir, and Panda sir. So thanks for wonderful session we had. Before we are going to announce, I just want to make one more announcement. Fever Foundation will be conducting another scientific event for all the postgraduate, which is PG poster competition, which we had last year. So this year also. So we are starting. You will be receiving the mail, and the link will be open. This is basically an electronic form you need to submit. So this will be in preparation to our FEFCON 2021, which will be on 5th and 6th November 2026. So it will be in the virtual poster presentation. Though the conference will be hybrid form, but the poster presentation will be in the virtual form. Next slide, please. And the last date for submission of your posters are 16th October. So the link will be made available to you. We have your email ID. It will be come to you also. Next slide. I just quickly tell you some of the rules and the guidelines for submitting your poster. The poster is acceptable only in the electronic poster form, and it should be in the PowerPoint presentation only, and no photograph or hard copy of the poster or photograph of the hard copy of the printed poster is not acceptable. It should be submitted only in a prescribed PPT one single slide format, which will be available to you in the link, which will be sent to you during registration. And you can either submit it as a case study or original research paper. And our scientific committee is going to screen all the submitted applications, and then they're going to pick top 10, and you will be made to make presentation to our scientific committee. Only the first author will be allowed to present the paper. And I'm reiterating, poster to be submitted as per the template only. And also please note that the title of the word should be limited to 15 only. So you cannot have a very long titles. And along with a single slide PPT, you are requested to submit an article in a Word form, which is about maximum of 500 words. So article should be in the Word format, and you need to follow the style of JAPI, the Official Journal of Association of Physicians of India. And all acceptance of the poster is at the discretion of our scientific committee, and the decision is final and it is binding. And during the conference, all the selected posters will be on the virtual hall, and it will be available for all the participants and the registered delegates of the conference to view it. So we will be also sending to all your departments all the information. So looking forward to get some interesting cases and original paper presentation. Thank you very much, and congratulations to the winners. I don't know, they are going to tell us now. And more than that, I feel all of you all winners who have participated, and really it was wonderful having you all. Right, sir. Over to you, sir, Anupam Prakash, to announce the winners if it is ready.
Well, yes, let us hear from Computer G and the scorer. Result of North Zone, yes, it is ready. So hold with bated breath and let us congratulate the winners. The winners are North Zone, Dr. Aditi Tongar and Dr. Kanav Khanna. Very good. So congratulations. Dr. Aditi Tongar from MMSI, MSR, Mullana, Ambala, and Dr. Kanav Khanna, PGMR, Chandigarh. So heartiest congratulations. So you have to book your tickets for Bengaluru. and Dr. Manjula will assist you to be there. You both have to work as a team, as Dr.
Yes,
Manjula
sir.
said, and you will be representing North Zone. So congratulations for today and best wishes for the final quiz that you will have at Bangalore.
Yes, sir.
So thank you and congratulations. So luckily, as I already said, you have don't have many competitors because everybody scored. And I think, as Dr. Manjula said, participation is important. And many of you actually could get the right answers, at least one or two, and that is really very great. But all the best to the winners, and to all those who participated, thanks and congrats for participation. Well, thank you and congratulations once again.
Yeah.
Dr. Ramesh, Dr. Shiblakshmi, you want to say anything? Otherwise, we hand over to Dr. Manjula.
So just
Yes,
one thing, we will book the
congratulations
tickets,
to the
sir. They will not.
I know,
Yeah.
I know. That is why I said you
So,
contact Dr. Manjula.
Fever Foundation winners, Fever Foundation will be contact you. Our Fever Foundation team will be contacting you and facilitate your all the travel to Bangalore and your stay. And secondly, we will also be sharing each other, Aditi and Kanna, you will be sharing each other contacts so that you can discuss and form a very strong team, because you will be competing with other zones for the final competition.
I will sound you a warning also, because you will find the same faces of Dr. Ramesh, Dr. Shubhlakshmi and Dr. Ghansham as quiz masters there also. So you be very, because Praveen is very kind, he will not only book your tickets, he will book the quiz masters tickets also. So you be very careful. Recognize them and be very careful from them.
Chalo. All the best to all of you.
Yeah.
Thanks
Yes,
very
all the
much.
best.
Thank you, Sudarshan sir.
Thank you,
He
thank
is
you,
the-
thank you,
everyone.
everybody.
Thank you,
Thank you, sir,
everyone.
for
Thank you.
staying till the
Thank
end.
you.
And Dr.
So,
Ghansham also.
Thank you,
Thank you.
thank
with
you.
the permission of all of
Yeah.
the judges, and can we
Yeah.
stop the live
Yeah,
recording?
yeah,
Yeah.
yeah.
Yes, sir.